Hi guys! Today we're going to discuss the different social factors that affects oral health. For starters, the type of lifestyle you lead plays a huge role. A person with a busy schedule will already be rushing to do so much in so little time. He'd probably be too exhausted at the end of the day to squeeze in time for brushing and flossing. Taking time off work just to visit a dentist? Yep, we didn't think so. But if you think about it, brushing takes just 2 minutes each time, and if your oral health is good enough, you'll only need to visit the dentist for an hour at most every 6 months. By doing the math, that's less than 0.5% of your time. Next up, your habits. This includes smoking, alcohol consumption, and diet. Smoking can affect your entire body and oral health in so many adverse ways. It can cause cancer, increase your risk for tooth decay and gum disease. It also gives you bad breath and makes you more susceptible to fungal infections. Research has shown that alcohol increases your risk for oral cancer by 6 times. Most alcoholic drinks contain a lot of sugar and can lead to tooth decay. It can also cause dry mouth and gum diseases. The time and frequency of food we take is important as well. Food that is sugary, sticky, and processed can increase the rate of tooth decay and gum diseases. And I don't just mean chocolates and Coke. Even the sugar from the healthy fruits can contribute to this. That being said though, you don't have to stop taking them completely. It's fine to give in once in a while. Just make sure to brush after. How does brushing help? Well, tooth decay actually happens when your teeth is exposed to acidic conditions for some time. The bacteria in our mouth produce acid from the sugar we eat, making the environment acidic. Brushing your teeth with toothpaste after every meal helps bring the environment back to normal. Alright, next. The general population can be categorized to low, middle, and high income classes. For those in the low and middle income groups, dental products and services may come off as just a little too expensive. Worry not though. Dental products are effective based on how properly you use them. It doesn't really matter how much they cost. What's more, visiting a clinic doesn't have to burn a hole in your pocket every time. There are clinic kesehatans all around Malaysia that provides treatment to anyone at very minimal fees. And for those living too far away, dental mobiles are actually sent to those living in the rural areas for treatment. Last but not least, the family and friends around you. Parents should reinforce regular and proper brushing as a habit for their children, and this should begin right from their very first tooth. The child's sugar intake should also be controlled, and it is very, very important that the child understands why. Another thing, babies should not be put to sleep with milk in their bottles. Milk is considered food, and so this will allow tooth decay to happen very, very, very quickly. Instead, substitute the milk with plain water. Yes, we all know that milk teeth will fall out eventually, but did you know that the permanent teeth actually forms underneath your milk teeth? And so, unhealthy milk teeth can give unhealthy permanent teeth. The simplest way then is to start proper oral health education from as soon as possible. Set a good example for your family, and they will follow too. And why keep it confined to just family? Set a good example for your friends, and influence them to practice good oral habits with you. If you care, you'll share. So, the next time you get lazy to brush and floss all the sugar and bacteria away, remember, it is so much easier to prevent a disease than to cure it. Thanks for watching. We'll see you next time.
Created using Powtoon.